Hello students, welcome to EPG Pathshala. I am Rashmi Sinha from Indira Gandhi National Open University. Today, we are going to talk on the module Nutritional Status Assessment of Children and Adults from the paper Human Growth, Development and Nutrition. After studying this module, what will you know? You'll know the different methods for the assessment of nutritional status, the measurement techniques of the nutritional anthropometry, various anthropometric indices useful in the assessment of nutritional status, and the advantages of anthropometry in the assessment of nutritional status. Malnutrition is one of the major health problems in most of the developing countries, that includes India. Assessment of nutritional status of the community assumes an important role in understanding the nature of the problem and its magnitude, geographical distribution among different age, gender and physiological group. Analysis of data and identification of the risk group and causative factors is essential for prioritization, development and targeting of appropriate action programs for prevention and control of malnutrition. There are direct and indirect methods for assessing nutritional status of a community. Now let us see what are the direct methods. They are 1. Prevalence of clinical signs, 2. Nutritional anthropometry, 3. Biochemical tests, 4. Biophysical methods. And what are the indirect methods? They are the vital statistics such as the morbidity rates and mortality rates, and assessment of ecological factors such as food and nutrient consumption, household food security, socio-cultural factors, medical and educational facilities, food production, socio-economic factors. No single method can provide a complete picture of nutritional status of a community, and hence it is necessary to use a combination of methods keeping in view the objective and availability of resources. However, in the present module, nutritional anthropometry is discussed in detail. Nutritional anthropometry. Now, what is the procedure for taking anthropometric measurements? Growth retardation may be first response of the body towards nutritional deficiencies, while appearance of clinical sign may be the final stage. From the public health point of view, identification of subclinical forms of malnutrition is very important for planning programs of nutrition intervention so as to prevent such milder cases going into severe forms with consequent risk of high mortality. Anthropometric measurements, that is body measurements, are the most widely used means to assess nutritional status. Use of anthropometric measurements depend on certain factors. Accurate age assessment, especially in case of preschool children. 2. Appropriate instruments. 3. Standardization of anthropometric techniques. Use of World Health Organization Child Growth Standards for children less than 5 years. Reference values for the older age groups are also there, and appropriate classification for grading nutritional status. Assessment of age. Elicit correct age of all the family members. In case of children below 5 years, age should be assessed up to the nearest completed month based on authentic documents such as the birth certificate, horoscope, immunization card and hospital record. In the absence of the above, the age should be assessed with the help of local events calendars prepared for the past 5 years based on different fairs, festivals or other important local events. In the case of individuals who are above the age of 5 years, assess the age up to completed years. World Health Organization New Child Growth Standards, which is also called MGRS. Use of body measurements like weight, height is meaningful only if the actual measurements obtained on an individual are compared with known normal values. These normal values are referred to as the growth standard or references values, and are obtained by surveying a large number of well-fed, healthy children who are medically and socially well protected. Generally, it is now accepted that the growth potential of well-fed children in all countries are similar and comparable. In the past, NCHS referred values were used to assess the nutritional status of individuals of different age groups and gender. Currently, World Health Organization child growth standards are being used of all over the world to assess the nutritional status of children up to 5 years in case of school age children and adolescents, that is between the ages 5 to 19 years of age. World Health Organization recommend age sex specific body mass index percentiles values which are used for grading the nutritional status. Measurement of height or length. Height is measured up to the nearest millimeter using anthropometric rod. In case of children of less than 2 years of age, recumbent length is measured by using infantometer. Now, what is the procedure? We ask the subject to stand erect on a flat surface with heels together and upper limbs hanging closely to the sides of the body. The investigator should stand on the left side of the subject. The anthropometric rod, after assembling, as you know, there are 4 segments in it. So, after assembling the 4 pieces and sliding head piece properly, held in the right hand, should be placed at the back of the subject, touching heels, buttocks and back of the head. The chin of the subject should be held by left hand and the occipital protuberance is supported by little finger on the right hand while holding the rod with thumb and index finger. The head should be positioned such that the imaginary line drawn from triggers of the ear to the infraorbital margin, that is the lower border of the socket of the eye, is parallel to the ground, which means the subject is in the FH plane or Frankfurt horizontal plane. By holding the head in this position, a gentle upward pull is applied, taking care that the subject does not lift his or her heels to straighten any curvature in the spinal cord. Then the sliding headpiece of the rod is brought down so as to touch the ground, firmly pressing on the hair, taking care that the blade is in the sagittal plane of the body. At this juncture, the height is read from the window of the headpiece. The process is repeated thrice and the consistent reading is obtained. Record the height in centimeters up to the nearest millimeter. As can be seen from this picture, anthropometer rod in the unassembled way. This is how we keep it in the bag which we get for the anthropometer. You fix, attach all the 4 segments. There are 4 segments in this anthropometer. You attach them and then you put the sliders there. While taking height or length, one is used, and later when you will see when we need to take the breath, both of them would be used. Same again, it is just showing anthropometer in the canvas case, how we keep it, and it's very handy when you take it to the field. In this slide, you can see, as we just talked about the procedure of taking height, how they are taking height of the boy, keeping the anthropometer behind because there is no wall here. So, when there is no wall, you keep the rod on the back and that's how you take the height. Next, same thing for the little child. Also, you need to see, because height should be taken as nearer to the eye plane as possible. Measurement of recumbent length. Now, let's see what's that. The height of young children below 2 years age is measured as recumbent length using infantometer. The child is laid on its back on the flat surface of the infantometer with head touching the fixed headboard and legs towards the movable sliding board. The infant's head is held firmly against the fixed headboard by the helper. The investigator should hold the infant's knees gently pressed down against the board with his left hand and the footboard is moved with the right hand so that it comes in contact with the soles of the infant at the right angle. The measurement is recorded in centimeters to the nearest millimeter. In this picture, you can see how the recumbent height is being taken of an infant. You just saw the video in that you were told about the recumbent length. Now in this picture, it is shown how it is done. Measurement of weight. Weight is the important anthropometric measurement most in use. Use of lever actuated balance with 100 gram of accuracy is recommended. In case of birth weights, an accuracy of at least 20 gram is recommended. The weighing scale should be placed on a firm and flat ground and zero error has to be adjusted. The subject is made to stand on the platform of the balance without footwear and with minimal clothing. In case of children, ensure that he or she does not hold any other person for support. The weight should be recorded to the nearest 100 gram, and in case of very young children and children who do not cooperate, weight should be taken along with the adult carrying the child. Then what you do is that the adult weight is then deducted from the total weight to get the child's weight. Here in this picture, you can see the subject is being asked to stand on the weighing scale barefoot, standing straight, and the weight is being recorded. Measurement of mid-upper arm circumference. Mid-upper arm circumference should always be measured on left arm using fiber-reinforced plastic tape up to nearest millimeter. The subject is asked to stand erect and the investigator stands on the left side. The left arm is folded at the right angles at the elbow, keeping close to the body. Distance from tip of the bony prominence of shoulder, that is the tip of the acromion process, to the tip of the bony prominence of the elbow, which is the olecranon, is measured. Keeping the tape in position, midpoint is marked horizontally, that is half the distance measured above. Then the arm is straightened and placed by the side of the body, hanging loosely. Tape is passed round the arm at the midpoint such that it closely covers the arm without applying too much of pressure or keeping it loose. The tape should not be elliptical but kept horizontal. The reading on the tape corresponding to 0 mark is the arm circumference. Here you can see the mid-upper arm circumference of the boy is being measured. He is standing straight and his hands hanging loosely on the side of his body. See, the tape is right between the acromion and the olecranon process, acromion process and olecranon. See, the tape is just horizontal, it is not sliding towards any side, and the measurement is being recorded. Measurement of waist circumference. In the recent past, particularly with the increasing incidence of obesity, considering the significance of abdominal obesity in diet-related chronic diseases, weight and hip circumferences are used to evaluate the abdominal adiposity in subjects. The subject should stand erect with weight evenly balanced on both feet, which are placed about 25 to 30 centimeters apart. This is very important because the subject should not be putting all the weight on one foot. Mark the level of the lowest rib margin, feel the iliac crest in the mid-axillary line and make a mark. Pass the measure tape around the waist horizontally midway between the lowest rib margin and the iliac crest and measure the circumference in centimeters up to the nearest millimeter. It is advised that the observer should sit on the stool in front of the subject while taking the measurement. It is very important that you should neither be pressing the tape very tightly nor you should be keeping it loose. It should be very aptly done and the eyes should be straight towards the tape. That's the best way to take. So, in such case, there will not be any error. Measurement of hip circumference. Place the tape horizontally over the buttocks and measure the circumference at a point yielding the maximum circumference in centimeters up to the nearest millimeter. So in this, care must be taken that wherever in the reading, you slide the tape little bit and record the reading where you get the maximum reading at when the tape is round the buttocks. Measurement of fat fold at triceps. Fat fold thickness is measured on the left arm using Skinfold. A number of Skinfold calipers are available, but Harpendens and Holstein calipers are recommended. We do have other kinds of calipers also, like Lange's, but then Harpenden and Holstein have been shown to yield the best results. A vertical fold of the skin is held with thumb and index finger 1 inch above the midpoint on midline on the back of the left arm of the subject, taking care not to include muscle. The caliper is held with right hand horizontal to ground and is pressed to open the contact surfaces. The caliper is applied to the skin fold and released slowly so that the contact surface touches the middle of the skin fold, taking care not to be too close to the arm or too loose to the edge of the skin fold. The reading should be noted immediately, as any delay will lead to gradual decrease in the measurement. This procedure is repeated thrice and a consistent reading is recorded in millimeter up to the first decimal. See how the triceps, the skin folds at the triceps is being taken. The fold is lifted at the midpoint of the left arm over the triceps muscle and the reading is recorded. Anthropometric indices or classification. Distance charts can be prepared for median anthropometric measurements according to age sex in comparison with WHO child growth standards in form of line diagram. Preschool children. The 1 to 5 year children are categorized into different nutritional grades according to weight for age by Gomez classification, Indian Academy of Pediatrics classification, and according to standard deviation classification for weight for age, height for age, and weight for height, as we will see below how it is being done. Standard deviation classification. The World Health Organization recommends the use of standard deviation classification to categorize the children into different grades of nutritional status. The percent distribution of preschool children according to undernutrition, that is weight for age, stunting, which is height for age, and wasting, that is weight for height, will be computed using WHO child growth standards as given in the table. You can see that SD classification is there, weight for age is there, height for age, and weight for height. Suppose the median is greater than or equal to minus 2 SD, then weight for age will be normal. When we consider height for age, again it will be normal. Similarly, weight for height would be normal, and other criteria also they have given. IAP classification, that is the Indian Academy of Pediatrics classification. In this case, the growth charts are based on the Indian Academy of Pediatrics classification using unisex Harvard standards. The children who are 0 to 60 months are categorized into various nutritional grades according to the IAP classification as follows to help comparison with the ICDS data. Here we can see if it is greater than or equal to 80 weight for age, then the nutritional grade would be considered normal, and if it is less than 50, that is the percentage of the Harvard standard which is calculated as weight for age, the nutritional grade would be grade 4 under nutrition category. School age children and adolescents. The school age children and adolescents, that is those between 5 to 19 years, may be categorized into various grades of nutritional status according to body mass index in comparison with age and gender specific centile values recommended by WHO Health Organization as given below. Here we have classification like BMI is 6 centiles and nutritional grade. Again, if the BMI is less than the 5th centile, the child or the adolescent is considered under the undernutrition. Adults. Body mass index. The adult males and females may be categorized according to nutritional status based on body mass index as suggested by James et al. In 1988. In this case, height and weight are taken. So the BMI and the nutritional grade. Now let us see if the BMI comes out to be between greater or equal to 18.5 to less than 20, then the nutritional grade will be low normal. But again, if it is greater than 20 to 25, the adult will be assigned as a normal, having the nutritional grade as normal. And of course, greater than or equal to 30 would be obesity of the level grade 2. WHO recommended cutoff level classifications. Now let us see how they have done. The earlier one was James et al. They did it and they considered the chronic energy deficiency. When we talked about the nutritional grade, they talked about the 3-degree chronic energy deficiency, 1-degree chronic energy deficiency. Now WHO let us see what is WHO's classification, which they had reported in 2000. If the BMI is greater or equal to 18.5 to less than 20, it is low normal. If it is greater or equal to 30 to 35, that is if the BMI is greater or equal to 30 or 35 kg per meter square, then you are classified as in the category of obesity grade 1, obesity 1. Now WHO also recommended the classification for the Asians. They had the different cutoff levels for the Asian and which they gave it in the year 2004. In that case, if the BMI is greater or equal to 23 to less than 25 kg per meter square, then the person is overweight, and if it is greater than or equal to 37.5 to less than 40, it is obesity. See, these are all different levels of obesity which they are talking from greater to 27.5 up to more than 40 kg per meter square. So in this case, we can see they also classified, and this is particularly meant for the Asians. Waist circumference, also denoted as WC, a cutoff value for waist circumference of greater or equal to 102 centimeters for adult men and greater or equal to 88 centimeters for women is recommended to identify individuals as having abdominal obesity. However, for South Asians, World Health Organization recommends cutoff levels of greater than 90 centimeters for adult men and greater than 80 centimeters for women to define the abdominal obesity. Then waist hip ratio, also denoted as WHR. All the adult males with a waist hip ratio of greater than 0.95 and women with greater than 0.80 will be identified as obese. Now, what are the advantages of using anthropometry for assessing the nutritional status both in children as well as in adults? The procedure are simple, safe, non-invasive technique and are applicable to large sample sizes. Second, the equipment is inexpensive, portable, durable and can be purchased locally. So one can take it to the fieldwork easily without much problem. 3. Relatively unskilled person can perform procedure. Ideal it would be that the person is first trained how to take the measurements and then they can follow up the procedure. 4th, methods are standardized and are precise and accurate. That's what makes it very significant because the method of taking each measurement is standardized. 5. The procedures are good in identifying mild, moderate, and severe form of malnutrition. And 6. The procedures are useful in understanding the changes in nutritional status over a period of time. That is, we can come to know the secular trends, whether they are positive, negative, or even if the secular trends are absent. Now let us see how the nutritional status can be assessed using the biochemical test. Most of the nutritional deficiencies are characterized by changes in body fluids and tissues. These changes can be used to assess the nutritional status of an individual. That is, the changes that take place in the body fluids and tissue. See, in case of a nutritional deficiency, we notice the changes, and with the help of these changes, the nutritional status can be assessed. The commonly used biochemical indices are estimation of hemoglobin, serum albumin, serum vitamin A, etc. Biophysical methods. Nutritional assessment may occasionally include selected biophysical methods to measure body composition, bone mineral density, physical work capacity, etc. Let us summarize this module with the advantages of anthropometry. Now, number 1, the procedures are simple, safe, non-invasive techniques and are applicable to large sample sizes. Then, the equipment is inexpensive, portable, durable, and can be purchased locally. This is very important because if it is portable, one can easily take it to the field and conduct the field work. 3. Relatively unskilled personnel can perform measurement procedures. They can be taught about the standard techniques and standard way how to take the measurements, and it will help a great deal. 4th, the methods are standardized and are precise and accurate. That helps in comparing the data also. 5. The procedures are good in identifying mild, moderate, and severe forms of malnutrition. And lastly, the procedures are useful in understanding the changes in nutritional status over period of time. That is, we are able to understand the secular trend. It could be a positive secular trend, it could be a negative secular trend, it can also be absent secular trend. Thank you.